Yeah, so brain cancer is interesting. It's one of these things. I'm not a cancer biologist, so I'm a neuroscientist, and but we saw an opportunity here again, in the spirit of bringing different disciplines together to be creative. We started thinking about brain cancer from a neuroscience point of view, and what's been what was pretty clear to me is that a lot of what we've learned so far about these cancer cells was when we study them in the tumor, sort of niche, in the tumor microenvironment, and not so much with the interaction with the healthy human brain. So we've been focusing a little bit more on that, and what's been remarkable is that it's very clear that when you expose those cancer cells to the human brain microenvironment, or the human brain in general, they change their identity to a point that they escape the treatment. And so we're thinking about it now more as, okay, the cancer are a moving target. And if we want a treatment that works, we need to lock them in the corner so to avoid them changing their identity and then throw everything at them. So we've sort of started thinking about it a little bit differently. And it's interesting for someone like me looking at cancer because oncology has made so much more progress in terms of translation than neurology, and kind of envious in some way. But it's more like, okay, can we learn from the oncology field and how they made the progress, and also learn about neuroscience, in this case specifically for treating brain cancer, and find a cure for people with the most aggressive form of brain cancer, which gives you about 15 months survival, which is terrific. So my team has been working on brain cancer for 5 years now, so a pretty short time. And within that short time, we've we made some small incremental, but I like to believe important, advances. First, we've shown that indeed the brain biochemistry can change the identity of the cells. And we've identified some repurposed drugs that potentially can prevent this type of plasticity and improve the current standards of care, which is chemotherapy and irradiation. It hasn't gone through a clinical trial yet. We're in the process of building this up, but there is a good chance. Well, if the drug works as well as we hope it does, the clinical trial can go very quickly because it's a repurposed drug, which has very low bar in terms of, IP and all this, so that should be pretty quick. We know it's been given to patients with anxiety, actually, which has nothing to do with brain cancer, but and we know already the impact it can have in terms of side effects on people. So if it does, if we manage to get to the brain tumor cells at the high enough dose, I think that can be quite interesting to see if that helps people with this disease.